Andre Fortin is on the line. So here's the deal. He, today, in the National Assembly, did something that I think a lot of us have been waiting to do. He, of course, is the Liberal MNA for Pontiac. He's the official opposition critic on health care, and brought up a motion, and I want to make sure I completely understand this. Andre, you brought up the motion. This motion that you brought up was unanimously adopted today. So explain to everyone what it was exactly that you wanted to have done and that you got done.
Yeah, good afternoon, Aaron. So we introduced a motion today that basically said two things. The first is nobody should have to produce an English certificate, an English language certificate or proof in order to access healthcare in English in Quebec. And this was done, obviously, after the last directive that the minister put out over the summer, about 2 months ago, which caused a massive uproar in the community, and rightfully so, and left a lot of place to interpretation, and a lot of people interpreted it to say that Anglophones would have to prove their eligibility for healthcare in English in the province if they wanted to have a doctor's appointment or a consultation or a surgery or any type of healthcare service. So the first thing we did was that nobody needs an English language certificate in order to access healthcare. And the second thing we did was ask the minister again to put out his directive, and that directive is as clear and explicit as can be to that effect. So I was pleasantly surprised to see that all parties, including the CAQ government, including the PQ, supported the motion. And hopefully they can put out this directive sooner than later. That's what I think a lot of people in the community are hoping and waiting for.
Okay, so my question in all of this is, and I had Jean-François Roberge on the show exactly 1 month ago when this whole OQLF directive thing became an issue. His words were, and he tried to reassure everybody because he kept saying, don't worry, nothing that's in this 31-page directive has anything to do with English. You can still get services. Nothing changes. He said, in fact, I think his words were the only thing it applies to were administration. And he gave a couple of very strange examples, like if you wanted to paint a wall in a hospital and you were the company doing it, you might have to do whatever paperwork you had to in French. It had nothing to do with service. But he also said, Andre, that he would seek to rectify, clarify, pick a word, that particular directive. And in that case, nothing has happened in a month. So nothing has changed in that directive. It hasn't, from my understanding, correct me if I'm wrong, it hasn't been withdrawn. You're asking now for clarification. So even though this motion passed today, and it's good that it passed unanimously, what happens to that directive if it hasn't been withdrawn? How do we know it doesn't supersede whatever was agreed to today?
No, exactly. So the directive that Minister Roberge published, or Minister Dubé published about 2 months ago, is still in effect today. All we had, and all that English-speaking Quebecers had at this point, was Minister Roberge going out there saying, I'm going to change it, don't worry, something's coming down the pipeline. Now today we've got unanimous agreement from all 125 MNAs from the National Assembly, including the Minister of French Language, including the author of Bill 96, Simon-Jolin Barrette, including everybody in the CAQ government, that they will put out a new directive clearly and explicitly saying that nobody will ever have to put forward an eligibility certificate to access healthcare services. Now, it doesn't change the fact that the initial directive published by Minister Roberge is still in effect, but at least it reassures us that it's not just Minister Roberge out there saying, yeah, I'm going to do this, and he doesn't without the approval of his government. On this file, Minister Roberge and the CAQ government have a deficit of credibility, and I trust them about as far as I can throw them, which is not far at all. So to have the unanimous agreement of everybody, I think, is the step in the right direction. The next step is for him to publish the directive.
So I guess I would ask, and I don't know if it's fair to bring this up in a motion. Yay, great that the motion went through. Is there a timeline attached to this, Andre, of any kind? Like, when does this have to be resolved by? Because if we go another month and nothing has happened, we just have this motion, what has that achieved?
Well, that's it. And that there is no timeline on it. And that's why we insisted that it be sent to the PDG, or the CEO of Santé Québec, the CEO of all the healthcare establishments, and the Deputy Minister of Health, so that healthcare workers know that, yes, there is this directive, but there's also every single elected Quebec politician here saying, well, hold on, you shouldn't apply the interpretations of this directive that may lead any healthcare worker to think that they have to ask for an eligibility certificate. That was the first thing that was most important to us, to get that message out to the healthcare network that they cannot and should not ask for this certificate.
And that note is being sent out by?
Well, it will be sent out by the National Assembly. So the president the president of the National Assembly will send out that note to all of the healthcare establishments, and it shows how everybody voted, including the French language minister. So I understand that it's not a change of directive, but it's about as far as we can go to get a commitment from our part, to get a commitment from everybody else around the National Assembly that this has to change.
I would ask one other thing. My understanding was, in this directive, were you to go ahead as someone in the healthcare or social service network and not follow through with what's in the directive, you actually could face sanction. You could face fines. You could face punishment of some kind. That's still out there.
That is still out there. That's the thing, and that's why Minister Roberge, hopefully he heard what all of his colleagues said today, and will put out this directive sooner than later. It's been 2 months since it was initially put out. It's been a month since he said, no, we'll rectify it. It doesn't take that long to do it. I get that he initially put out a 31-page directive, that they went into every detail, that they put out situations that probably caused more confusion than anything else. But if the directive now is Anglophones can access English services without an eligibility proof, that's pretty easy to write.
By the way, I will bring up one other thing. We were talking to James Mendy earlier in the show, and when I said English eligibility certificate, the one that's, of course, impossible to get, he said, be careful, because what if there's another certificate you need to show? But are there other certificates? If it's not that certificate, what else would you have to show? There isn't nothing, right?
I don't know of any other certificate.
Okay.
The only one that Anglophones have to, or anybody has to produce in order to get any type of service, is the education eligibility certificate to comply to or to withdraw from Bill 101 requirements. But you're right, they are immensely difficult to get. My wife is from Nova Scotia. She's an Anglophone. We got it for our kids, which we are entitled to do, but it wasn't the easiest thing to track down her school board in Nova Scotia and get the certificate. I can only imagine how hard it is for people who may be of a certain age. Okay,
so fair to say, Andre, for the time being, Anglos can breathe a little bit easier with respect to getting service in healthcare and social services.
For the time being, but we still need that directive to be put out, and that's our message to Minister Roberge today. It's one thing to reassure people; it's another thing to put it in writing with a formal government directive, and that's what we're asking him to do.
Was he in the House, by the way, Jean-François Roberge?
He was. He voted on this, just like Simon Jolin-Barrette. The Premier wasn't there, and the Health Minister wasn't, but to me, having the unanimous support of everybody who was there, I think, sends a pretty clear message.
All right. Andre, thank you so much. I appreciate the time.
All right. Have a great day.
You too. Take good care. So there you go. Step one. But again, this is only fully resolved, I guess, and he said as much, once that original directive from the OQLF is either withdrawn or rectified, whatever. That has not yet happened. We'll see how long it takes for that to actually happen.